Neutrophils are white blood cells and they're vital for the immune system. They help to fight against infections and to prevent inflammation. They're also called polymorphonuclear leukocytes, and they're white blood cells that protect from bacteria, fungi and other infections. They're the most abundant white blood cell in the body. They contain granules which are important for the antimicrobial effects. Like other blood cells, the neutrophils are produced in the bone marrow. However, they have a very short lifespan. They survive for less than 24 hours in the blood, and they'll undergo self-destruction automatically. The neutrophils are first responders at a site of infection and inflammation. The primary function of the neutrophils is to prevent infection by attacking pathogens that try to invade the body. Their quick response makes them the first group of immune cells to participate in the body's immune response. They produce antimicrobial substances and proteases, which are enzymes that help to degrade and kill the microbes. Neutrophils also recruit cytokines for the body's inflammatory response to infection. After they finish defending the body against the pathogens, some of the neutrophils activate macrophages, or large white blood cells, to help with their removal. The limited lifespan of a neutrophil helps to prevent further tissue injury and excess inflammation. A normal neutrophil range is around 1,500 to 8,000 cells per microliter. The range can vary slightly between labs due to differences in equipment, technique, and the chemicals used. Neutrophils usually account for 40 to 80% of the white blood cells. They can be normally slightly higher during pregnancy. A single test showing low neutrophils is not enough to make a diagnosis. A doctor will need to interpret the test, taking into account your medical history and other test results, and they'll repeat it if necessary. A result that's slightly low might not be of medical significance, as the test often varies from day to day and between people. Abnormally low levels of neutrophils in the blood that persist for longer than 6 months are called neutropenia. Some of the causes are bacterial and viral infections like the measles, EBV, adenovirus, hepatitis, sepsis, and HIV. Autoimmune disorders like lupus, rheumatoid arthritis, and type 1 diabetes can also decrease neutrophils. People with lupus have increased levels of neutrophil cell death or apoptosis. Many develop neutropenia, which is the abnormally low neutrophil level. A deficiency of vitamin B9 or folate, vitamin B12 and copper can interfere with the production of the neutrophils. Bone marrow damage and disorders can decrease the production of the blood cells, including neutrophils. An enlarged spleen can increase the destruction of the blood cells, including the neutrophils. Various cancers have been associated with lower neutrophils, especially when they metastasize to the bone marrow. Radiation therapy can decrease the neutrophils. Several drugs can decrease neutrophil levels, including antibiotics, antivirals, anti-inflammatory drugs, drugs used to treat an overactive thyroid, and chemotherapy. Some rare genetic disorders can cause low neutrophils, such as chronic benign neutropenia and cyclical neutropenia. The most important thing is to work with your doctor to find out what's causing the low neutrophils and to treat any underlying condition. You can keep your immune system running with a healthy lifestyle. Exercise, eating a healthy diet, and refraining from smoking and alcohol consumption. It's important to have a balanced diet that contains enough nutrients, such as vitamin B12 and folate, that are required to make the white blood cells, including the neutrophils. Regular, moderate exercise can also help to improve the neutrophil function and activity. When your neutrophils are low, you might be more vulnerable to infection, so proper hygiene can reduce your risk. Abnormally high levels of neutrophils in the blood is called neutrophilia. It's caused by many conditions listed below. You should work with a doctor or a health professional to get an accurate diagnosis. Infections caused by bacteria, fungi, viruses, and parasites increase the neutrophil numbers. Inflammatory conditions also increase the neutrophils. Patients with an inflamed appendix or appendicitis have a significantly higher than normal neutrophil count. However, the neutrophil count doesn't indicate the severity of the illness, and it's not sensitive enough to be a disease marker. Research shows smoking increases neutrophils. The stress response increases neutrophils, likely by increasing inflammation. Strenuous exercise can increase neutrophils in the short term. A study found not getting enough sleep increases neutrophils. Tissue damage due to an injury or surgery increases neutrophils. A study that measured neutrophils in 41 people with depression found their neutrophils were higher when compared to healthy people. Some drugs like glucocorticoids, adrenaline and lithium, and poisoning from lead, mercury and insect venom can also cause neutrophilia. Bone marrow disorders like leukemia can increase the neutrophil production. A mutation in the CSF3R gene promotes neutrophil formation, and this can lead to higher susceptibility for hereditary chronic neutrophilia. Too much neutrophil activity can increase the release of agents that are toxic to cells, or cytotoxic, and overactivate parts of the immune system. Under normal circumstances, this helps to protect your body from infections or injury. However, prolonged and unregulated release of these compounds can damage your body's tissue. Research suggests that neutrophils enhance plaque inflammation and hardening of the arteries. After a heart attack, neutrophils clear the dead cells and debris around the injured area. After the neutrophils die, macrophages release growth factors, causing inflammation and tissue formation, which makes scars in the heart or cardiac fibrosis. A high neutrophil to lymphocyte ratio is a predictor of heart disease. It's associated with an increased risk of an irregular heartbeat or an arrhythmia, and death in patients who are undergoing a procedure to treat heart disease. A study in 4,625 people found that higher neutrophil counts were associated with a higher risk of heart disease. Another study in 18,558 people found that the high neutrophil counts contributed to heart disease risk. Similar results were also found in another study in 4,860 men. In general, neutrophils may play a role in the start of cancer, tumor formation, and the spreading of tumors to other places in the body, or metastases. Neutrophils contribute to inflammation by releasing reactive oxygen species. Studies suggest they also suppress anti-tumor response. The neutrophil to lymphocyte ratio is a blood marker that scientists have used to predict the outcomes of various cancers. Multiple studies have shown that an increased neutrophil to lymphocyte ratio is associated with poor prognosis in colon, pancreatic, stomach, and lung cancer. In a review of over 100 studies with 40,000 patients, a neutrophil to lymphocyte ratio above 4 was associated with worse overall cancer survival rates. The most important thing is to work with your doctor to find out what's causing the high neutrophils and treat any underlying conditions. Stress can increase the neutrophil levels. This means avoid or manage stress can help to prevent the stress-related chronic inflammation. Make sure to get 7 to 8 hours of sleep per night. Restricted sleep has been associated with elevated neutrophil levels. People of African descent have lower neutrophil levels than those of European descent. This reduced count might be due to the variation in the Duffy antigen receptor for chemokine genes. Mutations in the CXCR4 gene are associated with WHIM syndrome, a rare disease where the body's immune system doesn't function properly. The WHIM patients have severe low neutrophil levels. People with Kotzmann's disease also have low neutrophil levels. To book a consultation or to learn about herbs, supplements and natural treatments, check out my website.